All right. Thank you so much, Hannah, and thank you all for joining this evening. Hope everyone had a good day and enjoyed all the sunshine over the weekend. We are going to talk tonight about how to talk with our daughters about puberty. So, just a little bit briefly about me. Did my training, medical school, and residency down in Houston at Baylor. And I was in private practice in pediatrics down there until 2019 when moved up here to the Seattle area and have loved living here and getting to practice medicine here ever since. So that's my professional background. And then personally, when it comes to issues of puberty, of course, I have personal experiences being a tween and teen girl. But what I don't have is a daughter who I have had to guide through puberty. I do have a wonderful 13-year-old son who did actually give me permission to, to mention him in this presentation. And then, of course, I have so many of your wonderful daughters as my patients. Here's a quick overview of what we're going to talk about tonight. We are going to discuss how to talk with your daughter about puberty. We're going to go over some basic puberty facts. We're going to talk a little bit about how to make sure your daughter feels confident and prepared as she gets ready to embark on puberty. And then at the end, there will be time for questions and conversation. And as Hannah mentioned, you can put questions in the chat and I'll do my best to address them at the end of the talk. And then there will be some polling questions that I ask as we go through that I would love for you to participate in because it kind of helps me get a sense of what's on your mind and what your experience has been with issues around puberty so far. So part one, we're going to dive right into how to talk about puberty. So we're going to start with a polling question. So this is for everyone. What was your experience like learning about puberty? No one told me anything. It was embarrassing and or scary and or confusing. It was great. I felt confident and prepared afterwards. Or this is my first time learning about puberty. So this is for parents and girls both. I just want to jot down whatever comes to mind. We'll give everybody a few minutes to respond. All right, let's see. So we got about half of the group out there found it embarrassing, scary, or confusing. Some people didn't get told anything, and I'm glad to see that at least a couple people had a good experience with it. That's always nice to see. All right. So hopefully by the end of this talk, everybody will leave feeling confident and prepared. Okay, so how to talk with our daughters about puberty. So the first thing that I always stress is try to make it a safe environment to talk with your daughter. And that means making sure she doesn't feel embarrassed, she doesn't feel shamed. And that means that we need to be careful to respond, very intentionally to any questions or comments she makes without laughing, without judging, without revealing our surprise at what she may or may not know. So keeping a nice, calm, steady, neutral tone is really important so that she gets comfortable asking all the questions that she needs and wants to ask. And one of the best ways we can do this is just start talking about it really early. The best time to talk about puberty with your daughter is as soon as she asks. And if she never asks, if it doesn't ever come up, then usually around, fourth grade for most girls, and you'll know your daughter best. If she's ready to talk about it sooner, great. If she needs a little more time, that's fine too. Some girls with older sisters know all about it from the time they're really young. But starting the conversation early is always going to help make it easier and make you both more comfortable talking about it as you get further into it. Check for understanding. So see what your daughter knows already. A couple ways you can do this is you can start the conversation with saying, well, tell me a little bit about what you know about puberty already. Or what do your friends say about puberty? What do kids at school, have to say about it? That kind of thing. So it kind of takes the pressure off a little bit. Then you get a sense of where she's at and how much or how little she may already know. And then, tied to that, in addition to what she already knows, what does she want to know? You may have in your mind an agenda about what you think is important that she learns, and absolutely you should cover that. But she may not hear a thing you're saying if the whole time she's waiting to be able to ask the burning question she really wants to know about, periods or breasts or whatever it might be. So make sure you leave room to get to what's most important to her, in addition to covering what you want her to know too. And then the last point about, how to talk to our daughters about puberty is it's really important that we use correct terminology. And some of this ties back into making sure she understands what you're talking about. So some of us, just have a really hard time struggling to use the proper medical terms for female body parts because of the way we were raised, or for whatever reason, we have nicknames for things that can make it really confusing for girls if you're using a nickname for a body part that she doesn't know what it means. And then conversely, if you're being overly technical or scientific about it because that's how you kind of deal with uncomfortable situations, then she may be just as confused. So we need to all get in the habit early on of being used to saying those words so that if we're comfortable saying them, our daughters will be comfortable saying them. So we all need to be able to just say vagina without too much fuss or embarrassment so that we project that confidence to our daughters as well, right? So we need to be able to talk about vaginas, breasts, all the body parts. She's going to need to know what her uterus is. She needs to know what labia are, vulva, ovaries, all those things. Boys need to know what testes are, what their scrotum is, what their penis is, all those things. So just take a minute, take a deep breath, and just practice saying those words out loud so that it's easier when the time comes to have that conversation. All right, so part two, puberty basics. So all aboard the puberty train. We often use the analogy of puberty as a train when we're talking about it with our kids, purely for the reason that puberty comes when it comes, just like the train. You can't make it come any faster. You can't make it later. It just arrives when it does, and you get on board. So here we go, all aboard the puberty train. All right, next question. This one is for the girls in the audience. Are you looking forward to puberty? Yes, no, or I'm not sure. So, girls, you can answer that however you're feeling this evening. And if there are any moms in the audience, you can reflect on, gosh, do I remember looking forward to that? Was I scared? Was I unnerved? Um, All right. So we've got a few who are looking forward to it, and a couple who are no, not so much, not really interested. And that's fair. It is completely valid to feel either way. Because it is a big thing and it's an unknown thing, and we want to try to make it something that even if you're perhaps not excited about, that you are not intimidated or scared about. So that's our goal for tonight. All right. So when does puberty happen? So puberty for most girls starts between age 8 and 14, which is a really wide range, right? If you think about it, that's anywhere from a third grader to a freshman in high school. And any of those are considered normal start times for puberty. Once puberty starts, on average, it takes about 4 to 5 years for the process to be complete. And that's a long time too, right? So, that it's not just like a year or two in junior high when this happens. The whole thing is going on for a significant span of your child's young life. So we're going to talk about the external physical manifestations of puberty. That's coming up in these next slides. So just to give you a heads up, there are going to be some drawings of body parts so that we all are on the same page what we're talking about. All right, so these are the stages of puberty, and puberty is kind of divided into stages 1 through 5. 1 is basically a little girl's body, and 5 is a grown-up woman's body. And so there are stages that happen in between. So the first signs of puberty in most girls, which we call stage 2, is when breast buds appear. And it might be one breast bud at a time, or it might be both at a time. Sometimes when those breast buds appear, they can be a little uncomfortable, a little sore or achy. That's all very normal, and that's important to know that that's normal. Start to get a little bit of, fine, sparse pubic hair down between the legs and the pubic area. And this is also the time when girls start to have that beginning of their really rapid growth spurt. So stage two, early puberty is, I say we're always getting training bras and new clothes because we are outgrowing all those clothes that used to fit. Suddenly we're getting a lot taller. And then maybe think about shopping for training bras as the breasts start to develop. Stage three is a little bit more significant breast development. There's a little mound under that breast bud, more pubic hair. Stage four, further development of the breast, greater density and spread of the pubic hair. And then this is usually around the time when the first period happens, is around stage three to stage four. And the, official medical name for first period is menarche. And then stage five is fully developed woman's body with an, female breast contour and adult pubic hair spread. This whole period from the first sign of puberty to when you get your first period takes about 2.5 years. So that's a lot of time, right? Let's scoot this up. So 2.5 years is a long time. One of the questions I get asked often in the clinic is, well, can you tell when her period is going to come? And really no, nobody knows for sure, right? That train comes when it's going to come. But in general, for most girls, if you can think back to when your daughter first starts to get breast buds, it's going to be about 2.5 years from then. Some girls get their period around the same time their mothers did, but not always. Um, things vary, and from generation to generation, we know that the average onset of puberty and average age at first period is getting a little bit younger for a variety of reasons, not all of which we understand fully. So that is still, though, the timing that the puberty takes, that has stayed relatively constant. Okay, so I'm going to talk a little bit about periods, what happens during a period, and this is just in very basic terms. And for most girls, the first time you talk about puberty with them, this is the very basic, all you need to know. You don't need to get into anything to do with eggs and fertilization, anything like that. You can just talk about the fact that when we get a period, what's happening is that there is a buildup of tissue that has a lot of blood vessels and red blood cells. It's full of nutrients and sort of thick blood-filled tissue that builds up on the inside of the uterus. The uterus is this organ that sits down in your pelvis, right behind your bladder, and you never notice it's there until you start getting your periods. And what happens is during a period, you get buildup of this tissue inside the uterus, and then after a little while, that buildup breaks down and goes away. And the way it exits your body is that it breaks up into little bits of blood and flows out through your vagina. And so that's what's happening here in this super basic schematic. It's important to know that even though there's blood involved, it doesn't hurt. So periods don't hurt. They may cause a little cramping. You may feel a little bit of uncomfortable, but they shouldn't be super painful. If for some reason you think, if for some reason your period is super painful, that is a time when you definitely need to talk to your doctor. And periods for most girls happen once a month. The first 2 years we get our periods, they can be really irregular though. Sometimes you can skip a couple months. Sometimes you can go have one period and go 6 months without another one. As long as they're not happening too often, as long as they're not too heavy, or lasting for too long, that's generally okay. Most periods are going to last between 3 and 7 days. And again, they're going to happen roughly once a month, but that can be anywhere from 3 weeks to 5 weeks. And the whole first 2 years you get your periods, they can be quite irregular. Now, if you're getting them more than twice a month, if they're happening every couple weeks, lasting way longer than a week, those are times to see your doctor. Other things are happening during puberty too. It's not just all about periods. There are changes happening to your skin, to your bones, to your hair. So skin starts to produce more of a substance called sebum that if it gets plugged up inside a little hair pore, you can end up with a pimple or a blackhead or a whitehead, and that's where we get acne. So your skin is going through changes caused by all the hormones circulating in your body. Your bones are going through major changes. You're doing a lot of growing. So really important now more than ever that you're paying attention to nutrition, making sure you're getting calcium and vitamin D, getting enough iron in your diet. If you're not sure whether your diet has enough of those things, that's a great thing to ask your pediatrician as well, because we want to make sure that we are growing healthy bones. There are changes to your hair going on as well. Again, those hormones flowing through your body are acting on the oil glands around your hair follicles to produce a lot of extra oil. And hair sometimes changes texture or density during puberty. There's a lot of things that can happen. So it's a really important time to be taking good care of yourself. Parents making sure you're talking with your daughter about hygiene, how important it is to shower or bathe every day. Have those conversations about wearing deodorant when adult body odor starts to hit. Making sure that we're washing our face with gentle, soap, using moisturizer, acne products if you need to. And then, again, if those are things that you're struggling with, things your pediatrician can help you out with too. And then there's all the things going on inside. So puberty is obviously a time of major emotional upheaval for our young kids. And they can go from happy and excited and over the moon one minute to sad and crying to angry all in the space of about 30 seconds. And that is all normal. It is challenging and it is really hard to watch as a parent and to try to understand and know how to help. But that emotional turmoil is a completely normal part of puberty, and your child is in there, and they will come back. They are in there underneath all of those wicked emotions. We just got to help them ride it out and come up with healthy ways to cope when they have all those feelings. This is just a super simple picture of parts of the brain that are involved in puberty. So the amygdala is the part of our brain that's involved in emotions. The prefrontal cortex is the part of our brain that is involved in things like thinking, planning, consequences, impulse control. And so you can guess when you're a teenager which one is all fired up. That's the amygdala. It is getting rapidly larger during the teen years, but you know who hasn't grown at all is the prefrontal cortex. So that part has yet to come online. And we're still growing our prefrontal cortex even into our early 20s. So if your teenager is making you scratch your head thinking, why are they being so irrational? Why can't they think about the consequences of their action? They literally don't have that part of their brain fully developed yet. But what they do have is a high reward-seeking, emotion-feeling part of the brain, which goes a long way to explain teenage behavior. All right, so question 3, this one is for the girls too. Which aspect of puberty are you most curious or concerned about? Breasts, periods, body hair, growing taller, or something else? Give everybody a minute to think about that. And if you answer other, hopefully, if I don't cover it by the end of the talk, you can jot it in the chat and we'll try to make sure we get to it. All right, let's see. Okay, so a little bit of everything. Thinking about breasts, periods, body hair, and getting taller. Okay, very cool. All right, part 3, feeling ready. So, the goal here is for every girl out there to feel confident and prepared as she gets ready to go into puberty. So, how can we do that? How can we help our daughters feel confident and prepared? Well, number one, we have to make sure that we, as parents, have all the facts at our disposal and know what we're talking about. And we need to start having those talks. So start having those talks early. And remember, it's not going to be just a one-time talk about puberty. You're going to have a super basic early talk. And then as your daughter grows and needs change and questions change, you have more and more talks down the line. So it's helpful to read about puberty so that we know what we're talking about and to get ideas about how to handle those tricky conversations. You came to this class, which hopefully has been helpful too, so that you feel prepared talking with your daughter. I'm going to give some specific book recommendations toward the end, but making sure that we're solid on our facts about puberty is always the first step. So that we can answer things as they come up. And then sometimes it helps to have a physical, tangible thing on hand that helps us feel ready and prepared. And once your daughter has started puberty, again, like we were talking about earlier, you got a couple of years before she's going to get her first period, right? From those first breast buds. But whenever she, starts to you expect that it might be coming soon, or if she's even just anxious about it, even though you know it's going to be a ways away, you can make a period kit together. And so that means putting together a little kit for her to carry in her backpack or overnight bag or a gym bag that includes things like pads and panty liners, extra pair of underwear, Ziploc bags for storing all that stuff, and then a jacket or cardigan. So this lovely young lady in the picture there has that flannel shirt tied around her waist. And this is the Pacific Northwest. Everybody's always got a jacket or a cardigan or something. Thankfully, girls, just so you know, leaking to the point where you have like spotting or staining or something on your clothes is really, really rare. But if you're worried that it could happen and catch you off guard, you can always just have a shirt on hand to tie around your waist in case you need it. And then I think it's nice to think about something celebratory that you might do when your daughter gets her first period, because it is a big step and an important milestone. And yeah, there's a lot of downsides to it, and it's kind of a drag to get your period. But if you can also, have something that you feel positive about it, then that is a really empowering thing. And so different cultures have different rituals and things they do when women get their first period. If you can make up your own for your family, and it could be going out to dinner or celebrating just the women in some way, whatever seems to make sense for you and whatever sounds good to your daughter. But it's nice to have something to look forward to in addition to all those things that we know we're not looking forward to as much. All right, when it comes to educating ourselves about puberty, there are a ton of good books out there. I just picked a few here. I really like The Care and Keeping of You. There's a part one and part two. Part one is for the younger girls. This is really nice for the younger girls in particular. It's just super basic. Um, Very relatable, not at all scary kind of information about puberty. For older girls who want to know more about, like period nitty-gritty, the Hello Flow, the guide is a good one. I also like Celebrate Your Body. It's very body positive, of course, as you can tell from the name, and just very sort of straightforward and sort of celebratory about all the wonderful things that are going on in your body. There are also books out there to help with families who have daughters who are on the autism spectrum or have other developmental disorders for whom puberty is going to be a little bit different just because their experience of the world and how they communicate within it is going to be a little different. So, What's Happening to Ellie is a nice example of one of those books to help um, those of our daughters who, have autism and related disorders. And then, as far as websites, healthychildren.org is a great one. This is through the American Academy of Pediatrics, and they have all kinds of different articles about different aspects of puberty. When it comes to the emotional side of things, we all know that mental health in kids and teens is more and more important and deserves more and more of our attention these days than ever. For girls themselves, on the right, the American Girl series, Friendship Troubles is a nice, just sort of like basic book to kind of help navigate all the emotional side of those teenage years. And then for the parents out there, Untangled by Lisa Damore. I love Lisa Damore's books. She has really thoughtful insights into the mental health and emotional lives of teenagers. And so this is a really nice one if you want to kind of dive deeper into some of the emotional aspects of puberty. All right, so I think we have a few minutes here left at the end where we can take some questions.
Great, thank you so much. So our first question here is if you have a recommendation for an age that girls should start wearing deodorant or wearing a bra.
Yeah, absolutely. So it depends on, it's not so much the age as to where they are in puberty, right? Because that can be different for everybody. But I would say even if your daughter, so as soon as your daughter starts to enter puberty and has more adult body odor, that's a good time to start introducing deodorant. So that could be, even 9, 10. I would say most girls, even if they haven't gotten very far into puberty by middle school, it's a good time to just start introducing it just for the sake of getting in the habit and the routine and understanding because it's going to be something they need to do soon, and that a lot of their peers will be doing. So middle school is a good time for that. The training bras, same kind of thing. You do not have to do training bras as soon as she gets breast buds. It might take a while before, she cares about how that feels or looks. But as soon as she expresses interest, then I would absolutely, support her in that. And it's so to a certain extent, it's really up to her. And if they want to do it young, I don't think there's honestly any harm in that, even if they're not going through puberty yet. I think it's okay we want her to feel in control. That's the main thing.
Great, thank you. Our next question is about unwanted body hair and if there's any recommendations on how to handle that.
Yeah, great question. And gosh, people these days have such a wide sort of approach to this, depending on, your culture and your personal preference and how you feel about it. Um, Unwanted body hair for younger girls, if it's things like legs or underarm hair, it's totally up to you, but you could always start with just really very careful instruction on how to shave body hair off. There are other options like depilatory creams that will dissolve the hair. Most young girls we're not going to mess with waxing or anything like that until you're a bit older, or it depends too what your daughter is doing. If she's doing competitive gymnastics or swim and she wants to get body hair, gone in a little bit more profound way, then you might want to explore some of those other options. But for most young girls, simple body hair removal with shaving, depilatory creams, is enough. And you can explore some of those other things like waxing. For most kids, that we things that some older women do to get rid of body hair. There's not a lot of good evidence in young kids that it's safe, and so we kind of steer away from things like laser therapy and stuff like that. But yeah, it's a good question.
Great, thank you. Another question about recommendations is if you have any recommendations about kind of first period products to have on hand.
Yeah. Yeah, absolutely. So there's all kinds of options out there. It's good to have pads in different size and thicknesses. It's good to have panty liners on hand because sometimes there will be just like a little bit of spotting in between periods, not a full flow, but you might just need like a little panty liner. Or, before the first period, girls will often get discharge that they don't like in their underwear. It's uncomfortable, and panty liners are nice for that too. And then there's period panties now, and they come in like such a wide range of options, which is fabulous. And so some girls just take to using period panties from the get-go, and that's awesome. Um, I think those are the best for just starting, pads in a variety of sizes, shapes, and thicknesses, panty liners, and then if your daughter's interested, period panties. And as you get further into it, a little bit older girls and then tampons. Are usually, again, unless you're doing something like competitive swimming or gymnastics, not like the first thing that we typically introduce, but it's up to your daughter.
Great, thank you. So our last question here is if you, sorry, I'm just reading the question here. Um, let's see. We've got a few people writing in about recommendations for deodorant. So if you have, and people asking about aluminum, and so if you have any recommendations on that front.
Yeah, absolutely. So, I think especially in the beginning when you're starting out, you don't need something that contains an antiperspirant, which is where the aluminum comes in. So there are some products out there that are combination antiperspirant deodorants, and the antiperspirant part is will contain the aluminum. And right now, there's certainly not enough high quality evidence to suggest that aluminum shouldn't be, used. And if you want to use it, that's fine. But a lot of people understandably just prefer not to, because there has been some concern in the past about effects of aluminum on the body, right? So, and the good thing is that most young girls don't need it. They really just need a deodorant. And so you can use there's a lot of really nice, like all natural products out there. Um, And in particular for young girls, I like to use ones for sensitive skin because they can sometimes react really harshly to strong scents and chemicals and stuff. So things like Dove are really simple and sort of like clean ingredients. But in general, anything that's just a deodorant that doesn't have a lot of scent to it is going to be a good choice for girls, especially in the beginning.